My name is Dr. Jan Jones and I'm a chiropractor and I'm currently studying physiotherapy as well. One of the things I see a lot in practice is people coming in with neck pain, especially waking up in the morning with severe pain just on that one side. They've got full range of motion one way and the other way, they just can't check their blind spots when they're driving. Now there's obviously a lot of pain into this area as well. So in this video, what I'm looking at is some self-help techniques that you could use for this pain. Now, ironically, I woke up this morning with pain in the neck, just in this area over here. And I'm going to show you my self-help routine that I use to get my neck going. Now, this might work for you, it might not. And the idea then is to get movement back into the joint. Because what happens is 9 out of 10 times the area becomes inflamed, it gets sore, and then a person doesn't want to move it. And that's the worst thing that you can do for it. If things progress, if things get worse, if this lasts longer than 2 or 3 days, you need to get it checked out, okay? Also, another word of warning is that we want to work with the pain, not against the pain. We don't want to push hard through pain. We want to just use pain then as a barrier or as a limit for how far we can do these movements. Enjoy the video. The first movement I'm going to show you is just slowly rocking side to side. So the idea here is to simply rock the neck like this, left and right, just to make sure that we keep some movement going in. Now you'll see that I can be barely to there at the moment, and I've got nice full range of motion towards that other side. So the idea then is to rock it from there. Number 2 then is to try and increase that range of motion on rocking. So we're going to start with the opposite side first. So we're going to go to the opposite side 20 times like this. And then to the painful side like this. Now, only up to the point of pain, don't force it through pain. Now you'll notice that it's already starting to release out, which is great. So we can repeat that another 2 times, 20 to the good side, and then 20 to the not so nice side. Now once you've done that, we're going to start doing a bit more specific movements, working on the muscles into this area here. So we're going to start with just a simple stretch. So again, we would like to do the good side first, so stretching across this way. Now here's a warning: if you feel pain on this side, don't force it and rather do the other way first. So I've got some pain when I do that, so I want to start with stretching it out in this direction. And we're going to hold that for a good 20 seconds. And during that time, you're going to feel that these muscles are giving a nice comfortable stretch. It shouldn't be painful. If it's painful, back off on a bit, but you want to try and get that stretch going quite nice and clear into that direction. So once you've done 20 seconds of that, what I want you to do then is to turn your nose down into this direction. What I call smell the armpit direction. And the same thing with this. You're going to feel some pain across here. And you hold that for a good 20 seconds. Now I decided to go to the good direction first because I had pain going into the bad direction. Now when I try the sore direction, I want to take it to the point where I only barely feel it. So I can already barely feel it over there, and I want to hold that for 20 seconds. Okay? Now usually if pain is on the side that you're bending like this, it's an indication that the joints are not happy. If it was the opposite direction, then it's indication of the muscle. So in my case, I'm looking at muscle involvement and joint involvement. And then turning the nose. And I can feel that one biting quite hard, going towards the armpit. We're going to hold that then for 20 seconds. So to see where we are now at this point in time, you can see that I've got quite a bit more rotation in my neck already, but I can still feel it biting in there. And I turn it the opposite direction, almost free with a bit of biting through there. So the next step we're going to do is work specifically on the muscle. Now this is what I call a modified ART technique, or active release technique. So you're going to take a big old thumb, you're going to find that spot that's the most painful in there, and you're going to press down and hold. So you can see I've got a big thumb on there. Now what we want to do is we want to slowly turn the head away. Nice smooth movements. And you'll feel that as you do this, rotation to that way becomes less and less painful. The pain's all going to be in here, but the actual movement itself is not painful anymore. And I would say do about 10 of those. Then from there, same thing. Now we're going to go towards the armpit again. So basically putting your chin towards your shoulder. Right, so that shows you what the ART technique looks like. Now lastly, we're going to look at how to work on the joints. Now this is where you need to be careful. Like I said earlier, if I'm turning that way and I feel the pain in here, I'm side bending this way and I feel the pain in there, and if I do this stretch and I feel the pain in there, it's most likely be some joint involvement. Okay. Now with the joint movement, the idea here is that I'm not going to try and crack my neck or do anything weird like that. We want to work within safe, nice boundaries. So what I'm going to do is I'm going to take my hands like this, and I'm going to put my hands over the joints like that. Now usually if you feel into these areas here, there'll be one or two that are much more tender than the others. So in my case, I can feel that one there is really tender. As a chiropractor, I would look for these areas that are dysfunctional, and I would then go do spinal manipulation on it. But we don't have that luxury when we're on our own. So the joint movement technique I'm going to use is going to be little rocking through those joints. So I'm going to take 2 fingers like this. So once I've got my fingers over there, I'm going to cradle it, and I'm going to slowly rock into that direction and into that direction. So what it looks like from behind. Now remember, my pain is turning towards that side. Now, when I apply the pressure, the pain's most likely going to be on the left, but I want to create movement towards the right. So rocking it like that. And not a lot. You want to do about 10, maybe 15 at the most. So now checking in with how we've done. So now, still good range of motion to the right, and a lot better range of motion towards the left. I still have pain. So that often happens in the situation. If that joint is inflamed, it's not going to go away magically immediately. Now I know a lot of YouTube videos claim that that's going to happen. That's not what happens in real life. So I would recommend then doing these exercises twice a day. Now, very important that you do this within your own limits, okay? Now, if this lasts longer than a day or 2, it's time to get it checked out. Then I would recommend that you go and see somebody, a chiropractor, a physio, osteopath, whoever deals with neck pain then specifically, to take it further and actually work on those joints to get them released. I hope this helps. Have a great day.